Welcome to the webinar, How to Conduct the Car Seat Tolerance Screen, a Training Presentation. I'm Suzanne Ogaitis-Jones, and I coordinate the Child Passenger Safety and Occupant Protection Healthcare Project here at the Maryland Institute of Emergency Medical Services Systems. This presentation and my project are funded through the Maryland Highway Safety Office. The goal of this presentation is to help train Maryland healthcare providers to administer the car seat tolerance screen. All messages meet best practice guidelines as of January 2021. As background to this presentation, the American Academy of Pediatrics has stated that preterm infants have an increased frequency of oxygen desaturation and episodes of apnea or bradycardia while sitting in a car safety seat. They therefore recommend that there be a period of observation of the baby in the car seat before discharge, and they recommend this for babies born before 37 weeks gestation. Note that the car seat tolerance screen test is this period of observation, but it has also been called by different names, including the Infant Car Seat Challenge, the Angle Tolerance Test, and the Car Seat Test. Also, the American Academy of Pediatrics, in conjunction with their neonatology unit, are updating their policy. I haven't heard of any major changes coming. I believe there may be more detail in it. So hospitals who are doing this test should have a policy for how to administer this test. And this presentation can definitely be helpful in creating a policy or updating your policy. This policy shown here happens to be from Meredith Medical Center, and it was adapted from Lippincott. The overall goal of the test is to determine if the baby can tolerate riding semi-reclined in his or her car seat. So ideally, the test should replicate the conditions the infant will experience after discharge when traveling in a vehicle. My project has created a flow chart to help hospitals see how this process would occur and what they would do at each stage. And this document is available for free as a download, and the website is shown here where you can get it, or you can email me at the email address listed there, and I can send you a laminated copy that would be nice for your staff resources. So who should receive the car seat tolerance screen? Infants who are born less than 37 weeks gestation, those who are at risk for impaired oxygenation when placed in a semi-reclined seating position, those with respiratory issues, those with hypotonia or neurologic issues, those with cyanotic heart disease. And then it's also important to consider testing full-term infants who are born weighing less than 2.5 kilograms, especially if they have other risk factors. So in preparation for this test, the family, the caregivers need to bring in their own car seat. As you know, discharge planning really begins in the hospital upon admission, or in this case, maybe upon arrival of the baby. If the baby is in the full-term nursery, the family should bring in the car seat as soon as possible. If the baby's in the NICU, they can bring in the car seat 2 to 3 days before discharge. Tell the parents that there's no need for them to bring in the base of their carrier type seat. So what would be an appropriate car seat for the baby to use? Well, the main thing is that it needs to be labeled for use for a baby of that size. So looking at the side of the car seat here, you can see the label says that it is used for babies beginning at 4 pounds and up through 30 pounds. And it also says for a height less than 30 inches. So this would be on the infant carrier type of seat. On a convertible seat, which can be used for a newborn if the newborn meets the requirements. So this particular convertible seat says it can be used for 5-pound babies up to 40 pounds. Okay, what about the timing of the test? The infant needs to be at least a day old, and the timing would be, a little bit before discharge. This test can be done any time of day or night, but make sure the caregiver is aware of it being conducted. Ideally, the caregiver is involved by helping to adjust the seat to fit the baby and then harnessing the infant. Some additional things to keep in mind for timing of the test. So determine the duration of the test per hospital policy. Obtain and record the baby's baseline vital signs in the crib. It is recommended that the test occur soon after a feeding, as this is typical of what will happen after discharge. For instance, the mom feeds the baby right before heading out the door to drive to the doctor's office. Continuing to talk about what is an appropriate car seat. A car seat that's appropriate should not be expired. And how would you know if it's expired or not? Work with the caregiver to check the labels and the car seat's instructions. So these labels on the left are from 2 different infant seats, and you can see the date of manufacture is on there. And then on the lower left label, it also lists the expiration date. For the upper one, you'd have to then look in the manual to see how many years after manufacture the seat is good for, which is typically something like 6 or 7 years. And then you would know if it's expired. Keep in mind that an expired seat is better than no seat at all. So if that should be an expired seat that the family has, encourage them to get a not expired seat. But if they have to use that until they can get a better seat, that is better than nothing. And you would want to document that in the medical record. The label on the right is from the convertible seat. Okay, to adjust the seat to fit the infant, you really need to read the instructions. It's really critical. And the instructions for how to use the car seats comes from the manufacturers and their engineers, with their guidelines reflecting what they have crash tested and therefore what they can legally support. Note, the information from manufacturers and from child passenger safety technicians does change over the years as we learn more through testing and as car seat designs are greatly improved. This means it's critical to read each car's seats and manual for specific instructions on how to adjust the seat to fit a newborn. The manuals come with the seats. Sometimes they're tucked into a storage place on the seat, but they're also available online. Many of the seats come with a head or body support. If an infant head or body support is provided by the car seat manufacturer, it should match the rest of the seat. That way you know it's not added in by the parent. And you can use it according to the seat's instructions. Head pillow use is often optional. Some manufacturers require that the body pads be used for the smallest infants. Some car seats provide an upper weight limit or a corresponding harness slot position for when you must stop using the pad. Do not use anything in or on the seat that was not provided by the manufacturer. Especially don't add anything behind or under the child, as this may interfere with proper harnessing. Okay, just to tell you what I'm going to talk about next, some general adjustments to a car seat that you and the caregiver may need to make include harness height relative to shoulders, harness length, the crotch strap, the harness width at the hips, and the infant fit with or without inserts. So really the parent should be doing this, but you can be assisting them and certainly showing them how to find the information in their instructions. So the first thing that you're probably going to be doing is looking where the harness straps are relative to the shoulders. The straps need to be moved so that they are located at or below the baby's shoulder height. Place the infant in the car seat with her back flat against the back of the seat and her bottom at the lowest point. Look to see which harness slot in the shell of the car seat is at the infant's shoulder level or below. For most car seats, you'll need to take the infant out of the seat to then move the straps. Note that some of the seats that are made for really tiny babies may actually have a lowest harness slot that might be too low, not the best slot for a full-term baby, maybe one on the bigger side. So you definitely do need to measure this and check to see which slot you're using. To move the straps, many car seats need to have the shoulder webbing unthreaded from this metal splitter plate that's right here. You would unthread one side at a time. And then you pull it out of the slot it's currently in and rethread it through the slot you want. And then you would reattach it to the splitter plate. So here you can see that it's being pulled out of a slot. and then it gets reattached to the metal splitter plate, which is under here. Some car seats need to have the harnesses shortened for really tiny babies, and this is becoming more common in car seats. So you can attach the harness straps to the metal splitter plate at a higher point with threading, like right here. And then for the bigger babies, you would use the full length of the webbing, so it would be attached down here. And with this particular seat, there's a label that shows when you would use the full length versus the shortened length, and it happens to correspond with the slots in the shell. There are some seats that are called no rethread harness seats, and they have a tab usually up somewhere like here that you would grab the tab, pull that, and then with the other hand you would pull the head insert, which also adjust the harness height, so you can slide it up or down to find the best position that corresponds with the baby's shoulders or slightly below. And on a convertible seat, it might look like this. Here's a tab that you would grab, and that would pull this whole mechanism here along with the shoulder straps. They're very easy to use. Okay, another adjustment you would need to make for most seats is the crotch strap position. There may be several slots that the crotch strap can come up through, which is also the buckle for all of the harnesses. In general, you don't want the baby ever sitting on top of the crotch strap, so it might need to be moved in or out to be the best fit. And here's some instructions from one seat that shows how to do that. Generally, you would take this little metal ring and you turn it sideways and push it through the slot in the shell, and then pull it out in the slot you want and flatten it. There's also an adjustment with this particular seat that would make it shorter, this webbing part shorter for the tiniest of babies. So be sure to read the instructions carefully to see if you have that option. So for the tiniest babies in their car seat, you really want to check, you want to check and see if the head pillow that comes with the seat is pushing the baby's head forward so that the chin is close to the chest, because this could restrict breathing and quite possibly cause the baby to fail the car seat tolerance screen. This can happen even if the baby otherwise fits the harness really well. So this would be a time where you could consider removing the head insert, as long as the manual allows you to remove the head insert, so check carefully. In rare cases when a tiny baby doesn't fit properly in the car seat, even after adjusting the car seat harness parts, and if the manufacturer allows it, you may place a rolled receiving blanket along each side of the baby for lateral support. Now this is tricky because some manufacturers do not allow this, so you have to look at your manual. And as I said, there are some seats that are made for tiny babies. A few seats even can be used starting at 3 pounds, and they usually have features that make those seats fit these babies beautifully. You don't need to add anything else, and in fact those seats will tell you not to. Note that new best practice recommendations that align with safe sleep guidelines recommend that rolled blankets must not be above the baby's shoulders to reduce the risk of restricted breathing if the baby's face turns to the blanket. Okay, this is different from this picture, but this fits with safe sleep guidelines. Note also that in some seats there could be a gap between the crotch strap and the baby's crotch, in which case the baby might be slumping, sliding down in the seat and submarining, and that wouldn't be very good. So if that is happening in your seat and you can't do any other adjustments with the crotch strap, check and see if the manufacturer allows you to roll up a small towel or a washcloth and place it between the baby's legs and behind the crotch strap. Okay, to summarize some of the adjustments, this is what we talked about. We did not talk about harness width at the hips because that's only in a few seats, but when you're looking at the part that tells you how to adjust the harnesses and the crotch strap, it would be listed there and you can make those adjustments. Okay, the next step for what you would be doing to get ready for the car seat test would be to recline the seat properly. It's really important to recline the car seat according to the manufacturer's specifications, and you would check this using the indicator guide or the line that might be on the side of the seat. So in this case, the line is on a sticker on the seat, and it needs to be level with the ground when installing the seat. Sometimes the lines are embossed into the shell of the car seat, which can be hard to see, but they are there. Other indicators are little gauges. Here it should be all blue when it's in the right place. Here the green tab needs between the lines. And then there's also dual indicators, which are very nice. So they have a level a recline that is appropriate for the smallest babies, like this one. The ball would be in this area, or for older babies here. Same with this one down here. Do not use the infant car seat base to recline the car seat because the base is designed to recline in the car, and it may not actually be representative of what's the proper recline on a flat surface. Plus, it's extra work for the families to bring that into the hospital. If necessary, you can use a small towel to maintain the proper recline angle. Okay, so the next step would be securing the baby in the car seat and securing the harnesses. So this is a mother putting her baby in the seat. Well, what's wrong here? Well, this baby is placed in the seat so that she's kind of slumped. You can see her chin is sitting on her chest and she's kind of curled up a little bit. This would not be the right way to position the baby. It would be compressing the chest, and it may restrict the baby's breathing. It could cause the baby to unnecessarily fail the car seat tolerance screen. So instead, you want to place the baby in the seat with the baby's back flat against the back of the seat and bending at the hips. And then you can start to buckle the harness straps, keep the chest clip low, start to tighten the harness straps. And usually you do this by pulling out this tab that's at the front of the seat. You want to take out any looseness through the length of the harness. So pull up on the harness strap here to take any looseness out of the hip area, and then feed it up into the shoulder area where this is going to take up that slack. And then after you've buckled it and you think you've gotten it tight enough, you can move the chest clip up to the armpit area. So how tight is tight enough? Well, you could do the pinch test, have the parent do the pinch test. So if you can pinch webbing, and this person has a lot of loose webbing, but if you can pinch any webbing, then it's too loose. This harness strap should be snug against the baby, but not indenting into the baby's skin. And of course, you don't want to put really bulky clothes on under the harness, because that you'd have to have a loose harness to fit over all of that. Household clothes are fine. So this baby on the right is buckled up properly, and that is the right snugness, and it looks like this baby's enjoying that. So just to summarize, the best ways to help the infant breathe properly in the car seat. Make sure the child is positioned properly. Back flat against the seat back, child's bottom at the lowest part of the seat. The bending is at the hips, not at the waist. And that the child's head is not tipped forward. So this means reclining the seat according to the manufacturer's indicator. And if you haven't done this already and there is a head pillow, you could remove this if it seems like it might be pushing the child's head forward, and its use is optional. Okay, so now you're ready to start the test. So you have your equipment, you have your monitors. You want to turn on the monitors and set the lower alarm limits according to your hospital's policy. You want to place the leads on the baby per your hospital's policy. And you want to place the pulse oximeter on the baby's foot or hand. Then you would conduct the test according to your hospital's policy. Best practice is 90 to 120 minutes, or the duration of the car ride home, whichever is longer. Note that if it's more than a 2-hour car ride, you really should be taking the baby out to change the diaper, feed the baby, just let the baby move a little bit before you continue your car ride. If the baby is positioned improperly or fits the seat poorly, he or she may show signs of respiratory distress. Reposition the infant and continue to monitor. If you haven't done this already, you could remove the head insert at this point if it is allowed. So this is the best practice, Maryland best practice pass-fail criteria, which is based on research, published research on this car seat tolerance screen by Natalie Davis and others. but check to see what your hospital's criteria is. Document any changes in the infant's state or any changes that you made. For instance, like if you removed the head insert, you should note that, or if you added a side support. So this baby passed the test. But what if the baby meets any of the fail criteria? If that happens, then you want to discontinue the test and document the results. Best practice recommendation for after any failure is to take the baby out of the car seat and place supine in a crib or warmer on a continuous pulse oximeter for approximately an hour, checking for bradycardia and/or desat events. If there are no respiratory or cardiac events, then the baby can have the car seat tolerance screen repeated in 12 to 24 hours. A longer time delay allows for the infant's full recovery from the car seat tolerance screen, and sometimes the babies just need a little more time to grow. You can consult with a child passenger safety technician also to see if proper fit in the car seat was an issue, and there are virtual options for this. If your hospital does not have a child passenger safety technician, please contact me at MarylandEMS or Maryland Kids and Safety Seats to discuss the test process and next steps. If there are any respiratory or cardiac events in the crib, or if there is a second fail with the car seat tolerance screen, consider a NICU admission for observation and a sleep study with a pediatric pulmonologist. One common solution is to send the infant home on oxygen and on a monitor. It is recommended that those babies have the car seat tolerance screen repeated before removing oxygen support, and a referral to a pediatric pulmonologist, and there are hospital billing codes for this outpatient procedure. So why might babies fail the car seat tolerance screen? Dr. Davis, who has done most of the research on this test, suggests some of these might be reasons for failing the test. So regardless of whether the baby passes or fails, you should explain the results with the caregiver. And then always recommend that for the first few car rides, an adult sits in the back seat, buckled up near the newborn in his or her car seat to further monitor the baby. In very rare cases, a car bed could be considered for discharge, but typically a car bed is not needed nor recommended. Most cases when a car bed is required involve very serious and rare conditions, such as hydrocephaly. Infants must have the car seat tolerance screen administered while in the car bed and pass that test prior to discharge in a car bed. And many infants will not pass the test in either a car seat or a car bed. Due to the complexity of using car beds, consult with a child passenger safety technician with special needs training for fitting the child in the car bed, and have the caregiver consult with the technician about installing the car bed in their vehicle. And then it's really important to have the child retested in their own car seat before you move them out of the car bed into their own car seat, and they of course have to pass that test. So there's a lot of steps to occur, and the fact that once the child's been discharged, they can't usually be brought back into the hospital for the retest can make it kind of complicated, and a lot of pediatricians aren't really sure what to do about car beds. So here is a case study, brief case study, from a nurse who is also a child passenger safety technician. And she was called in about a full-term baby who had failed the car seat test multiple times. She observed the baby sitting in her car seat, and she thought the baby didn't look right, just distressed, and coloration was off, even though the baby was seated and harnessed properly. So she requested a NICU consult and more tests to rule out problems. And the sleep study showed obstructive apnea. The baby had desaturated to less than 70 the day before. So this baby then had an additional 5-day stay for observation and went home on oxygen. I've mentioned some of the research, and that a lot of these best practice guidelines came through the research done by Dr. Davis. Dr. Davis is at the University of Maryland Medical Center, and she gave a webinar for us on the research end of things, which is archived on our website, so that's listed here. You could also find out more about the research by looking at her latest publication done in conjunction with Dr. Benjamin Hoffman, and there's the citation for that. So if you would like to do a hands-on exercise, here is the exercise. Of course, you need some car seats and some dolls, but this could also be the basis for a competency for nurses who are administering this test. And I'd like to end with a little misuse exercise. So I'll show you some photos and you determine what is wrong here. So hopefully you figured out what is wrong here. In this first photograph, the harness straps are too high. They are above the child's shoulders when they need to be at or below the child's shoulders for any rear-facing child. Also, there is no chest clip shown here. It could be that it's just so low that you can't see it in the photo, or possibly this could be a European seat which may not have a chest clip because their standards are different. In picture 2, the misuse is that the family has added some products that did not come with a car seat. Much as those little shoulder pads are cute, they don't match the car seat, and that's not the problem. It's that they've added in something that the manufacturer did not approve. There really is no need to add this in. A lot of the seats come with little pads to soften the edges for the babies, or you could just pull the baby's shirt up a little bit to soften those edges. And in adding these in, it might loosen the straps as well. For the third picture, what is wrong here? In this case, a blanket roll was added around the baby's head. This is a particularly bad thing to do because very easily that baby could tilt his head forward a little bit, and then this roll will drop down behind the baby, forcing the baby's head forward even more, which is likely to block the airway. So you don't want to add anything that doesn't come with a seat, except for in the rare cases where you might add a rolled receiving blanket alongside the baby for more support and not up around the baby's head. And picture number 4. So there's a few problems here. The harness straps are too loose overall, everywhere. They are too high. They're coming from a slot above the baby's shoulders. There's a blanket tucked in on the side that really isn't needed if the straps were tightened. It's quite possible the infant has outgrown this head pillow. That's a little harder to tell with the picture. And there is also a toy in the car seat, which is generally not recommended in case that could hit the baby in a crash. So I hope you got all of those right. If you have any questions about this presentation or specific questions about conducting the car seat or about updating your policies, I would be more than happy to talk with you. The best way to reach me is to email me through this address, cps@mims.org. And thank you very much and take care.